Welcome back. Now we're talking about STIs. This time around, I want you all to consider what sort of screenings and tests should be mandatory regarding HPV and HIV. Feel free to also discuss whether you believe the HPV vaccine should be mandatory for all girls and/or boys before they enter middle school. Please also think about how the U equals U science and campaign does and should factor into reproductive health care. Lastly, how do abusive relationships impact a person's risk for STI contraction and need for reproductive health care? I am assuming most folks in class understand and know the basics of sexually transmitted infections or STIs. In this class, we are going to focus on HIV and HPV. Both HIV and HPV are viral STIs. Neither can be totally cured, and while both can have fatal consequences, AIDS and cancer respectively, both can be managed if detected early. Let's start with HPV. Human papillomavirus is the most common STI in the US. The CDC offers great basic information on HPV, some of which I will share with you now. You can get HPV by having vaginal, anal, or oral sex with someone who has the virus. It is most commonly spread during vaginal or anal sex. It also spreads through close skin-to-skin touching during sex. A person with HPV can pass the infection to someone even when they have no signs or symptoms. If you are sexually active, you can get HPV, even if you have had sex with only one person. You can also develop symptoms years after having sex with someone who has the infection. This makes it hard to know when you first got it. In most cases, 9 out of 10, HPV goes away on its own within 2 years without health problems. But when HPV does not go away, it can cause health problems like genital warts and cancer. HPV can cause cervical and other cancers, including cancer of the vulva, vagina, penis, or anus. It can also cause cancer in the back of the throat. This can include the base of the tongue and tonsils. Cancer often takes years, even decades, to develop after a person gets HPV. Genital warts and cancers result from different types of HPV. You can do several things to lower your chances of getting HPV, including getting vaccinated, getting screened for cervical cancer, and using latex condoms effectively. There is no treatment for the virus itself. However, there are treatments for the health problems that HPV can cause. Genital warts can be treated by your healthcare provider or with prescription medication. If left untreated, genital warts may go away, stay the same, or grow in size or number. Cervical precancer can be treated. Women who get routine Pap tests and follow up as needed can identify problems before cancer develops. Prevention is always better than treatment. Other HPV-related cancers are also more treatable when diagnosed and treated early. The CDC offers these recommendations for the HPV vaccines, of which there are 3 FDA approved. The only one distributed in the US protects against 9 HPV types. HPV vaccination is recommended at ages 11 to 12 years. HPV vaccines can be given starting at age 9 years. All preteens need HPV vaccination so they are protected from HPV infections that can cause cancer later in life. Teens and young adults through age 26 years who didn't start or finish the HPV vaccine series also need HPV vaccination. Vaccination is not recommended for everyone older than age 26 years. Some adults aged 27 through 45 years who are not already vaccinated may decide to get HPV vaccine after speaking with their doctor about their risk for new HPV infections and the possible benefits of vaccination for them. HPV vaccination in this age range provides less benefit because more people in this age range have already been exposed to HPV. I always enjoy reading your various thoughts about whether the HPV vaccine should be mandatory for children entering middle school, and often hear important and critical thoughts from folks on all points of the spectrum that this question elicits. What are some of the disparities that impact whether people can access cancer screenings and whether people get cancer? The NIH piece assigned covers foundational barriers, including factors related to the social and built environments, socioeconomic status, access to healthcare, and individual health behaviors. Let's now move to HIV, and first it is crucial that I celebrate with you all the U equals U campaign and body of research supporting it. If you have not heard by now, U equals U, or undetectable equals untransmittable, demonstrates that if a person has an undetectable HIV load, they cannot transmit the virus. This has huge implications for continuing to reduce HIV shame and stigma, continuing to empower HIV positive folks to make sustainable choices around treatment, and supporting access to diagnostics and treatment. Please be sure to look through the Prevention Access Campaign website, which goes into the concept of U equals U in more detail. I would hope that many of you have already received education dispelling myths about HIV, but in case not, here goes. HIV is not transmitted by casual contact. Activities that promote the transmission of HIV from one person to another include having vaginal or anal intercourse without a condom, having oral sex without a barrier, sharing needles contaminated with infected blood, sharing of sex toys without disinfection, and in utero infection from mother to fetus. Having anal intercourse, multiple sexual partners, multiple exposures to HIV, and an existing STI all put you at greater risk of contracting HIV, as does engaging in injection drug use. Preventing HIV contraction involves using barriers consistently and correctly, getting tested regularly for HIV, and talking with sexual partners about their sexual history and health. And AIDS is the most advanced stage of HIV. You can avoid getting AIDS if you start treating HIV appropriately. Which brings us to PrEP and PEP. PrEP, or pre-exposure prophylaxis, reduces your chances of getting HIV from sex or injection drug use. When taken as prescribed, PrEP is highly effective for preventing HIV. PrEP reduces the risk of getting HIV from sex by about 99% when taken as prescribed. Although there is less information about how effective PrEP pills are among people who inject drugs, we know that PrEP pills reduce the risk of getting HIV by at least 74% when taken as prescribed. Currently, PrEP shots are not recommended for people who inject drugs. PEP, or post-exposure prophylaxis, means taking medicine to prevent HIV after a possible exposure. PEP should be used only in emergency situations and must be started within 72 hours after a recent possible exposure to HIV. Disparities exist in HIV transmission, and there are concerns, as discussed in the Boonstrip piece, about how routine HIV testing could impact individuals living with HIV and the clinics offering the testing. I look forward to reading your thoughts on health disparities and ideas around mandatory testing and treatment. Lastly, intimate partner violence comes with a host of risks to emotional and physical health for survivors, and reproductive health does not escape these risks. You have one piece covering the topic in this module, and you will also read a couple in the next module when we discuss contraception and emergency contraception. Fontenot notes that intimate partner violence, or IPV, was significantly associated with individual sexual risk factors including the number of sexual partners during the past year, history of STIs, drug and/or alcohol use prior to intercourse, and anal sex. IPV was also significantly associated with partner-related sexual risk factors including condom non-use, partner non-monogamy, and partner at risk for having an STI. The results from the study underscore the pervasiveness of violence in young women's lives and highlight how screening for partner violence in conjunction with STI and HIV risk behaviors is necessary. Thanks for listening, and I'm looking forward to reading your thoughts this week.